When should you have your kid evaluated by an orthodontist? Is it at 7 years old? Is it at 10? Is it at 12? Is it at 14? Well, it depends. It depends on a lot of things, and I'm going to be talking a little bit more about when you should send your kid to the orthodontist. So let's go. Hey guys, this is Dr. Robert Passamano. I'm a board-certified orthodontist. In this video, we're going to be talking about the appropriate time to have an orthodontic screening by an orthodontist. The American Association of Orthodontists recommends an evaluation at 7 years old. At that time, the first incisors and the first molars, those are adult teeth, those should be erupted, and we'll do an evaluation at that time to determine if you need a phase 1 treatment or not a phase 1 treatment. I made a video about phase 1 treatment that I'm going to link at the end of this video. The top 7 reasons for phase 1 treatment: crossbites, canine crowding, underbites, crowding, open bites, impacted teeth, and nasal breathing issues. So the first question you need to ask yourself is, does your 7 to 9-year-old need phase 1 treatment? If the answer is no, then you will proceed to do one phase of treatment around 12 to 14 years old, and then proceed to have a retainer so you can have straight teeth the rest of your life. We usually take an x-ray at that 7 to 9 years old range to determine whether or not there's enough space for all the teeth. In this x-ray, you can see that there's plenty of space for all the teeth to come in naturally. And in this case, I would not recommend a phase 1 treatment, and we would just see the patient 12 to 14 years old for a one-phase orthodontic treatment. If the answer is yes to needing a phase 1 treatment, then you'll proceed with a year to year and a half phase 1 treatment, and that's usually done between the ages of 7 to 10 years old. That's usually followed by a 1 to 2 year long break where there is no active treatment going on. The kids usually wear something called a phase 1 retainer, and then after those 1 to 2 years, we'll go back into treatment called phase 2, and that's usually done 12 to 14 years old. Following phase 2 is retainers to maintain your straight teeth for the rest of your life. Here's a couple quick examples of phase 1 treatment. In this image on the right, we're seeing expander and braces. You can see that the crossbites are corrected. The teeth are brought together. We have room for the lateral incisors. This is what we call canine crowding, where there's not enough room for the canines to come in straight. We use an expander and braces to make more room, and then the canines will come in normally. And then this is an open bite treatment that's done with an expander and braces to close the open bite, so that way the patient can speak and say the S's and the T's, as well as swallow a little bit more efficiently. Here's a quick little recap of this video. Does your child need a phase 1 treatment? If the answer is yes, then you'll proceed with a phase 1, and then a phase 2, and then retainers. If your child does not need a phase 1 treatment, then you'll proceed with one phase of treatment, 12 to 14 years old, and then retainers. We all end up in the same spot, which is retainers to maintain straight teeth for the rest of your life. Thank you guys for watching When to Send Your Kid to the Orthodontist video. Hopefully you found it useful. If you want to learn more about phase 1 treatment, check out my video, Top 7 Reasons Why to Do a Phase 1 Treatment. Also, don't forget to like and subscribe, and I'll see you on the next one.